This video is on appendicitis. Appendicitis is inflammation of the appendix and is a medical emergency. Let's look how this occurs. There is progressive obstruction of the appendiceal lumen. Obstruction is commonly due to feces but can also be from tumors or gallstones. Obstruction causes stasis of luminal contents. This causes luminal distension and bacterial overgrowth, leading to increased intraluminal pressure and hence reduced flow of lymph and blood. This results in ischemia. Ischemia coupled with bacterial proliferation is gangrene, which the appendix is particularly susceptible to as the appendiceal artery is an end artery. There is an inflammatory response to bacterial overgrowth. Edema accumulates around the tissue and neutrophils infiltrate the lumen muscle wall and periappendiceal soft tissue. So how does a patient with appendicitis present? Initially, inflammation stimulates visceral sympathetic fibers at T10, causing colicky pain in the umbilical region. Later, the appendix contracts and the parietal peritoneal nerve causes constant pain in the right iliac fossa. Anorexia is an essential symptom of appendicitis, and if not present, you should seriously be considering other differentials. Patients may also have changed bowel habits, malaise, and nausea and vomiting. On examination, there may be tenderness at McBurney's point, so 1/3 between the anterior superior iliac spine and the umbilicus. Rosving sign may also be present, which is pain in the left iliac fossa after compression of the right iliac fossa. These signs are present if the appendix is at the normal position, so at the convergence of the tena coli at the cecum. However, this diagram shows the positional variance of the appendix. The most common variant is retrocecal and has a psoas sign. If there's pelvic variation, obturatus sign may be present. Finally, a post-ileal position may manifest with testicular pain. Diagnosis is a clinical diagnosis which requires a high index of suspicion, as you need to be very careful not to miss it. An abdominal and pelvic CT may be done to show fat stranding and fluid accumulation around the appendix. There can be acute, subacute, or chronic complications of appendix if left untreated, and this is why it's so important not to miss it. Due to bacterial overgrowth, there may be an appendicular mass or abscess. If the inflammation spreads to the adjacent bowel wall, it can cause paralytic ileus or constipation. Also, due to the high intraluminal pressure, as discussed before, there may be perforation. Now, if it is contained by the reflections of the peritoneum, it causes an abscess. However, if there is free perforation, it can cause peritonitis, septic shock, and death. Subacute complications include suppurative thrombus of the portal vein, as the portal vein drains the appendix. As it drains into the liver, it can also cause an intrahepatic abscess. In the long term, adhesions may form, causing bowel obstructions. Treatment is a surgical laparoscopic appendectomy. Antibiotics should be given in the form of ampicillin, metronidazole, and gentamicin. Supportive treatment of IV fluids and analgesia may be also indicated. Thank you for watching. If you found it useful, please tell a friend who may also learn something.